A zirconia crown is one of the densest, most durable ceramic restorations in modern dentistry. With the right care, you can expect it to protect your tooth for 10 to 15 years, or even longer. But because the ceramic itself is incredibly strong, it is easy to assume the entire tooth is invincible. The reality is that the natural tooth structure underneath that crown is just as vulnerable to failure as it was before. To reach that 15-year mark, you need a specific maintenance routine. We're going to walk through exactly how to clean the crown, which habits you need to break today, and how to track your long-term oral health. Go ahead and grab a soft bristled toothbrush, some dental floss, and your custom night guard if you have a grinding habit. The strength of a high-end dental restoration relies entirely on the daily habits you use to protect its biological foundation. Step 1 is defending the crown margin. This is the exact seam at the gum line where the artificial zirconia cap ends and your natural tooth structure begins. This diagram shows a cross-section of a zirconia crown setting over a natural root. As you eat throughout the day, microparticles of plaque naturally accumulate right at this vulnerable seam. The zirconia cap itself will never decay, but if that trapped plaque is left sitting at the margin, it will rot the natural tooth structure right out from underneath the ceramic. To clear this, angle your toothbrush at exactly 45 degrees to the gum line. Sweep upward and away from the gums to physically dislodge the trapped plaque from the seam. Next, take your floss and wrap it tightly around the base of the crown tooth, forming a C shape. Glide it gently to sweep along the margin edge and clear the spaces the brush cannot reach. You will know you are cleaning the margin correctly when your surrounding gums remain firm, pink, and show absolutely zero bleeding during flossing. Mastering this specific hygiene technique protects the biological foundation, ensuring your crown stays securely anchored in your mouth. Step 2 targets how you use your mouth. Having a heavily restored, durable tooth makes it tempting to use your bite as a utility tool. You need to immediately stop using your teeth to open plastic packaging, bite through tough shipping tape, or crack hard items like nuts and seeds. Stop before you bite. Put the package down and grab a pair of scissors instead, every single time. Zirconia is engineered to absorb massive, blunt chewing forces. However, it is highly susceptible to sharp, localized torque, the twisting motion created when you tear into an object. That twisting action generates extreme leverage that can cause microfractures in the underlying cement holding the crown in place. Treating your crown strictly as a chewing surface, rather than a Swiss Army knife, prevents the mechanical failures that force early replacements. Step 3 is for anyone who clenches or grinds their teeth in their sleep. This habit, known as bruxism, places uncontrolled pressure on your entire jaw. Monolithic zirconia is exceptionally dense. When placed under grinding pressure, it will almost always win the battle against your natural enamel. This diagram illustrates what happens during nighttime grinding. If the ceramic crown grinds heavily against a top natural tooth, the zirconia remains perfectly intact, but the opposing natural tooth begins to crack and wear down. A custom night guard acts as a nightly shock absorber. When it slides in between the upper and lower teeth, it diffuses that destructive friction, protecting both surfaces from damage. You will know this step is working when you wake up in the morning with zero jaw tension and no unexplained tooth sensitivity. Wearing a night guard protects the rest of your mouth's ecosystem from the immense strength of your new crown. Step 4 is proactive monitoring. You must schedule professional dental checkups every 6 months to maintain your restoration over the long term. Between visits, pay close attention to subtle signals from your mouth. Watch for any new temperature sensitivity or the sudden feeling that your bite has shifted. Do not ignore minor looseness or bite discomfort, assuming it will simply resolve on its own over time. During your checkup, your dentist will specifically test the integrity of the margin seal and confirm that your bite alignment is distributing force evenly. Catching a slight bite shift or a degrading seal early usually requires a simple 5-minute adjustment in the clinic, avoiding a total catastrophic crown failure. Your daily maintenance routine comes down to 4 precise steps. 1. Clean the margin. 2. Use tools, not your teeth. 3. Wear your night guard. And 4. Track your bite. By strictly following this routine, you maximize the lifespan of your restoration and set it up to last the full 15 years. If your bite currently feels off, or if you need to be fitted for a custom night guard, call your restorative dentist today to book a consultation. The long-term success and pristine appearance of your smile is now completely within your daily control.